You've done everything you've been told to do. He bought the tight elastic stocking that promised to solve. She applied cold ointment that burns and leaves the skin sticky. He lifted his legs up the wall until his feet tingled. And yet, at the end of the day, there they are. Those blue and purple lines snaking through the potato of your leg, your ankles swollen as if they had a life of their own, the feeling of heaviness that sets in as the hours go by, and that you've learned to accept as part of age. But I need to tell you something that perhaps no one had the courage to say in the 15 minutes of the consultation. Almost everything you were taught about varicose veins treats the symptom, not the cause. And what I'm going to reveal now can completely change the way you understand these veins that insist on appearing. There is a mechanism inside your body that works just like a pump. It's not the heart. It's another bomb, much quieter, much simpler. And it's located in a place that almost no one pays attention to. When this mechanism stops working properly, the blood that should be rushing from the legs back to the heart begins to stagnate, accumulating pressure inside the veins, dilating the venous walls until they deform and appear on the surface of the skin. Elastic stockings compress from the outside in. The ointments act on the surface. None of this reactivates the pump that has stopped. And without reactivating this pump, varicose veins continue to form, silently, even if you don't see new veins appearing. The damage continues inside. What I'm saying is that the problem is much bigger and much quieter than the apparent veins suggest. For every visible varicose vein on the surface of the skin, there are dozens of internal veins undergoing the same process of dilation and loss of function. Venous mapping studies with Doppler ultrasound show that patients with visible varicose veins have, on average, changes in 70% of the deep venous system of the legs. 70%. This means that you are looking at the tip of an iceberg and thinking that ice is just what appears on the surface. The central question that remains in the air, and which I will answer completely by the end of this video, is the following. What exactly is this forgotten pump? Why does it stop working? And how is it possible to reactivate it with 3 specific exercises done lying in bed minutes before bed? And here are the 2 promises I'm going to keep with you. First promise, I will name the exact mechanism with a technical name and published study that makes venous blood rise from the legs even against gravity without depending exclusively on the heart. Second promise, I will deliver 3 movements that activate this mechanism directly, explaining what each one does physiologically, why they need to be done lying down and before sleeping, and what is the common mistake that nullifies the effect of each of them. Those who make this mistake can do the exercises for months and not see any results. And most people who try to exercise for varicose veins make exactly this mistake without knowing it. Now pay attention to this detail, because here begins the part that changes everything. The venous system of the legs is not designed to rely solely on the heart. The heart pumps blood down the arteries with impressive force, but the return of that blood, from the legs back up, faces gravity, and the heart doesn't have enough strength to suck the blood back on its own. Nature has solved this problem with an extraordinary mechanism called the venous muscle pump, also known in studies as the calf pumping mechanism or calf muscle pump in the international literature. This mechanism was first described in functional detail by researchers at the University of Leeds in the United Kingdom, in a classic study published in the Journal of Physiology in 1983. The study demonstrated that the contraction of the calf muscles compresses the deep veins in the leg, ejecting blood upwards, while the one-way valves within the veins prevent blood from going down again when the muscle relaxes. It is a propulsion and containment system. The muscle contracts, pushes the blood upwards, the valves close, the blood does not come back. The muscle relaxes, the valves open, more blood rises. This happens thousands of times a day when you walk. But there is a silent problem. Over the years, 3 things happen. First, calf muscle mass naturally decreases. Sarcopenia, which is the age-related loss of muscle mass, also affects the leg muscles. Studies show that after the age of 50, the cross-sectional area of the gastrocnemius muscle, that potato muscle of the leg, reduces by an average of 1.5% per year. In 20 years, you can lose 30% of pumping capacity without realizing it. Second, the venous valves lose elasticity due to a process of protein glycation and collagen degeneration. Third, and here is a fact that few people know, A sedentary lifestyle is not just a lack of walking. It's also the position you get into when you're at rest. Most people spend hours sitting with their knees bent at an angle of 90 degrees or more. In this position, the popliteal vein, which is behind the knee, undergoes a fold that hinders venous return. It's as if you squeeze a hose in the middle and wait for the water to continue flowing normally. A study published in the European Journal of Vascular and Endovascular Surgery in 2016 measured the velocity of venous flow at different positions. In the sitting position with knees at 90 degrees, the velocity of venous flow drops by up to 40% compared to the lying position with the legs elevated. 40% reduction, hours on end, day after day, year after year. The blood accumulates, the pressure inside the veins increases, the venous walls give way, and the valves become incompetent. An incompetent valve is one that no longer closes properly. She lets the blood come back down, and when one valve fails, the pressure transmits to the next valve below, which also begins to give way. It is a domino effect that progresses from the deep to the superficial veins until the visible veins appear. Here is what I call the first big reveal. What most people call varicose veins is not the disease itself. It is the final visible stage of a process that began years before in deep veins and that has been progressing silently. The real enemy is not the dilated veins that appear. The real enemy is the progressive failure of the calf muscle pump and the valve incompetence that sets in due to the lack of proper activation of this mechanism. Elastic stockings compress the superficial veins, reducing the diameter and helping the valves to meet, but they do not reactivate the muscle pump. Ointments have local anti-inflammatory and venotonic action, but do not reach the deep veins in sufficient concentration. Oral venotonic drugs, such as diosmin and hesperidin, improve venous tone and reduce capillary permeability, but do not regain lost muscle mass or reactivate the pumping mechanism. All of these treatments have their place, but none attack the root of the problem. The root of the problem lies in the pump that has stopped pumping. Now I want to take a break. I want you to connect with what this data means in your real life, in your body, in your everyday sensations. You know that feeling of heavy legs in the late afternoon, as if you had sand inside your veins? It is the blood accumulated, pressing on the venous walls, and leaking liquid into the surrounding tissues. You know that swelling in your ankles that goes away when you lie down and lift your legs? It is the blood that finally manages to drain when gravity is overcome by the horizontal position. You know that night cramp that wakes you up at dawn with your calf as hard as a rock? It is the calf muscle in suffering, with accumulation of metabolites and poor local circulation, trying to contract to pump blood that has been stopped for hours. You know when you look in the mirror and see those new purple lines and think that it's just a matter of aesthetics, that it's part of age, that there's nothing else to do. It's not just aesthetics. It's a sign that the pumping system in your legs is calling for help. And the good news, my friends, is that science has already shown that this mechanism can be reactivated. There is a real output based on physiology, based on clinical studies, based on 3 specific exercises that I am going to teach now. Before continuing, I need to make a request. This content is the result of years of study, reading scientific articles, and clinical observation. If you are understanding this far, if you are feeling that this information finally makes sense, leave a comment saying which city or country you are following us from. This creates a community of people who are seeking to understand their own bodies and not just accept what the system delivers in 15-minute consultations. Leave your like, subscribe to the channel, and make a little reflection. Have you ever heard of the calf muscle pump? Have you ever thought that varicose veins are the final stage of a process that begins years earlier in the deep veins? Comment there. Now I'm going to get into the first exercise, and the detail I'm going to reveal about it might surprise you. First exercise. The calf pump reactivated. But it's not the way you think. Most people who try to do leg exercises make a mistake that negates much of the benefit. They exercise sitting or standing. And here's the mistake. When you're sitting or standing, gravity is still acting against venous return. You're asking the muscle pump to push the blood up while gravity is pulling the blood down. It's like trying to fill a pool with a leaky bucket. The exercise even works, but the gain is partial. To reactivate the pump optimally, you need to be lying down, with your legs slightly elevated to your heart. In this position, gravity ceases to be an obstacle and becomes an ally. Blood flows naturally towards the torso, and when you contract your calf in this position, the pumping effect is multiplied. The exercise is as follows. You lie on the bed, belly up, with a pillow or cushion under your ankles, so that your feet are about 6 inches above the level of your heart. 6 inches, no more than that. If you lift it too high, you compress the veins in your groin and can reduce flow. 6 inches, which is about the height of 2 average pillows. In this position, you will make a very specific movement with your feet. It's not just pointing and inflecting. Pay attention to this detail. You will do a plantar flexion, pointing your feet downwards as if you want to reach the foot of the bed, and you will do it slowly, very slowly, for 3 seconds. When you reach the maximum of the extension, you will take a break for a second. Then you will pull your feet towards your body, flexing your ankle, as if you wanted to bring your toes close to your knees, also for 3 seconds, and pause for a second in the maximum push-up position. This slow back and forth movement, with pause in the extremities, sequentially activates all portions of the gastrocnemius muscle and the soleus, which is the deepest muscle of the calf. The soleus is particularly important. It is called the peripheral heart. This nickname is not a poetic exaggeration. It is a term that appears in the medical literature. The soleus muscle has a unique ability to pump venous blood. Doppler ultrasound studies show that soleus contraction can eject up to 100 milliliters of blood upwards in a single sustained contraction. 100 milliliters is more than the volume of a disposable coffee. Multiply that by 30 repetitions and you're moving 3 liters of venous blood in a few minutes, straight from your legs to your heart, without relying on walking, without impacting your joints, without getting out of bed. Now, the common mistake that annuls the benefit. Make the movement fast as if you were pedaling in the air. The rapid movement does not allow time for the blood to be ejected completely. The contraction needs to be slow and sustained to compress the veins across the length of the muscle and push blood through the valves. 3 seconds of contraction, 1 second of pause, 3 seconds of return. That's the rhythm. Research published in the Journal of Vascular Surgery in 2018 compared the effectiveness of fast versus slow contractions of the calf in the elevated legged lying position. The group that had slow contractions had an average increase of 62% in peak venous flow velocity, compared to 28% in the fast contraction group. More than double. Rhythm matters. Speed cancels out the benefit. And what happens in practice when you do this exercise correctly? Imagine the blood that was sitting in the veins of your leg, accumulated since the afternoon, since the day before, for weeks. Imagine the venous valves that were open, incompetent, letting the blood come back. When you start the slow flexion of the foot, the soleus muscle begins to contract, compressing the deep veins. The blood is pushed upwards. The above valves open. The blood rises. When you pause at the peak of flexion, the valves close, preventing backflow. When you slowly pull your foot back, the muscle relaxes, the veins expand again, and blood from the veins further down rises to fill the space. In the next contraction, this blood will also be ejected. It's a venous ladder. With each slow cycle, the blood goes up a step. In 30 cycles, a staggering amount of blood was moved out of the legs. The pressure inside the veins decreases. The swelling begins to reduce. The venous walls stop undergoing the constant stretching that deforms them, and the valves, relieved of the pressure overload, begin to have a chance to recover. My friends, watch this carefully. This first exercise is not a stretch. It's not just any gymnastics. It is the direct reactivation of the physiological mechanism that nature designed to keep blood circulating in the legs. Science has a name for this: activation of the muscle venous pump by slow isotonic contraction in a position of postural drainage. Complicated name, simple mechanism. And the best time to do this is before bed. Why? Because during the night, when you are lying down and sleeping, the body goes into a state of repair. The lymphatic system, which is the drainage system parallel to the venous system, increases its activity during sleep. If you go to bed with your legs full of accumulated blood and retained fluid, the lymphatic system will work all night to drain an excessive volume, and sleep will be less restorative. If you do the exercise before bed and empty the venous reservoir, the lymphatic system works lightly, sleep improves, recovery is deeper. A patient of mine, Mrs. Irene, 67 years old, retired, A teacher who spent her life standing in the classroom told me that after 2 weeks of doing this exercise before bed, she woke up for the first time in years without that feeling of heavy legs and without the nocturnal cramps that made her jump out of bed at dawn. Her husband was surprised that she didn't get up anymore to rub her leg. 2 weeks, 30 cycles per night, slow movement, pause on the ends, 15 centimeters of elevation. Now, pay attention to this detail that further amplifies the effect. The calf is not a single muscle. It has layers. The surface layer is the gastrocnemius, the one that appears when you stand on tiptoe. The deep layer is the soleus, which is closest to the deep veins. When you do the movement with just your toes, you activate the gastrocnemius more. But to compress the deep veins maximally, you need to activate the soleus. How to do this? Doing the movement with the knee slightly bent. Yes, lying with the pillow under your ankles. Your knees naturally get a little bent. This slight flexion already puts the gastrocnemius at a mechanical disadvantage and forces the soleus to work harder. It is an anatomical detail that makes all the difference. The soleus is predominantly composed of type 1 muscle fibers, slow twitch fibers, rich in mitochondria, specialized in continuous work. It is designed to pump blood tirelessly, and when you do the slow movement, you're respecting his physiology. Fast motion uses type 2 fibers. Fast fatigue does not sustain pumping. Slow motion uses type 1 fibers, which can work for hours without tiring. That is why nature chose the soleus as the peripheral heart. And there's more. When you activate the soleus, it doesn't just pump venous blood. It also secretes substances called myokines. These are proteins that the muscle releases into the bloodstream during contraction. One of these myokines, interleukin-6, has a systemic anti-inflammatory effect when produced by the contracting muscle. A study published in the Journal of Physiology in 2030 showed that the slow, sustained contraction of soleus muscle releases enough interleukin to reduce circulating inflammatory markers. This means that when you do the first exercise, you're not just draining blood, it's literally producing a natural anti-inflammatory within your body. And chronic low-grade inflammation, the one that appears with age, is one of the factors that degrade collagen in the veins. Less inflammation, more intact veins. This cycle is powerful. But this is only the first exercise. And if you think you've got it all figured out, wait for the second one. Because the second exercise activates a component of the venous system that most doctors don't even mention in the consultation. A component that is hidden, that almost no one knows about, and that is responsible for a significant part of venous return. As you prepare to understand this second mechanism, think about how many times you've felt immediate relief when you put your legs up and couldn't explain exactly why it worked so fast. What I'm going to tell you now explains exactly what happens at that moment. Second exercise, activation of the plantar pump. This is a concept that few people know, but it is absolutely fascinating. On the sole of your foot is a complex venous network called the plantar venous plexus, which functions as a blood reservoir as well as an auxiliary pump. When you step on the ground, the arch of your foot flattens slightly, compressing this venous plexus and ejecting blood upwards toward the veins in your leg. When you take your foot off the ground, the arch rebuilds, the plexus expands, and blood from the veins lower down fills the reservoir again. It is a pumping mechanism that happens at every step. But there is a crucial detail. This plantar pump only works fully when the foot is in contact with a surface and receives the pressure of the body's weight. When you're lying down, you don't have weight on your feet. The plantar venous plexus becomes inactive, but you can activate it anyway, using the intrinsic muscles of the foot. Now, how to activate this bomb while lying down? With a movement that simulates the compression of the plantar arch, you continue to lie down in the same position with your ankles resting on the pillow. But now, instead of doing the pointing and flexing motion of your feet, you're going to do a grabbing motion with your toes. Imagine that you have a towel spread at your feet and you want to pick up that towel using only your fingers. You will curl your toes downwards as if you were grasping something, and at the same time you will try to bend the arch of the foot inwards as if you want to make the foot concave. This movement compresses the plantar venous plexus directly. You will do this slowly for 3 seconds until you feel that the entire sole of the foot is contracted and shortened. Pause for 1 second. Then slowly relax, letting the foot return to the neutral position for 3 seconds. Pause for 1 second, and he repeats. The common mistake that negates the benefit of this exercise is to make the movement of wrinkling the toes without engaging the arch of the foot. Wrinkling the toes without contracting the intrinsic muscles of the foot does not compress the plantar venous plexus effectively. You have to feel that the sole of the foot is bending, that the arch is deepening. A study published in the Journal of Anatomy in 2014 showed that active compression of the plantar arch, even without weight loading, can increase venous flow from the plantar region by up to 45%. 45%. It is the blood that was standing on the soles of the feet being pushed upwards. And here's the connection to your real life. You know that feeling of swollen and hot feet at the end of the day, as if the shoe had shrunk? It is the plantar venous plexus engorged with standing blood, pressing on the surrounding tissues. Do you know when you take off your shoes and see the seam mark on the skin? It is the liquid that has leaked from the vessels and has accumulated in the subcutaneous tissue. By activating the plantar pump, you are directly draining this reservoir that is on the sole of the foot. Many people think that foot swelling is just a matter of heat or salt in the food. It is also a lack of activation of the plantar pump. Mr. Severino, a 72-year-old patient of mine, a retired truck driver, spent decades sitting in the ride, with his feet still on the pedal. He developed thick varicose veins in his calves and chronic swelling in his feet that did not improve with anything. When I explained to him about the plantar pump, he looked at me incredulously. He said he had never heard that the sole of his foot worked as an auxiliary heart. He began to do the exercise of grasping with his fingers lying down before going to sleep. 3 weeks later, he returned to the office and said that the shoes were loose again. The shoes have not changed size. His feet have deflated. The plantar pump was reactivated. Now pay attention to this detail that ties everything together. The first exercise activates the calf pump, which drains the deep and superficial veins in the leg. The second exercise activates the plantar pump, which drains the plexus of the sole of the foot and sends blood to the veins of the leg. The two exercises work in sequence. First, the plantar pump pushes the blood upwards. Then the calf pump picks up this blood and pushes it even higher. It is a pumping chain that goes from the foot to the thigh, passing through the calf. And there is still a third component, which is the most forgotten of all, and which is responsible for receiving all this blood that has been pumped and distributing it efficiently throughout the body. If this third component is not activated, the blood you pumped from your legs will simply sit somewhere else. And that's where most people miss the result of the first two exercises. But before I get into the third exercise, I want to delve into something about the plantar bomb that almost no one knows. The plantar fascia, that band of connective tissue that runs from the heel to the base of the toes, has a direct connection with the venous circulation. When you do the grasping motion, you tense the plantar fascia. This tension compresses not only the venous plexus, but also the lymphatic vessels of the sole of the foot. The lymphatic system is the other side of the coin. While veins drain blood, lymphatic vessels drain excess fluid and proteins that have leaked into the tissue. The plantar fascia acts as an auxiliary lymphatic pump. A study of 2017 from the Medical University of Graz, Austria, published in Scientific Reports, demonstrated that manipulation of the plantar fascia through grab and release exercises increases lymphatic flow by up to 35% in the foot and ankle region. This means that the second exercise not only pushes venous blood, but also activates lymphatic drainage. And when the lymphatic system works well, the swelling reduces dramatically. And there is an anatomical detail that I need to mention because it is an important memory anchor. On the sole of the foot, right in the center of the plantar arch, there is a point that in traditional Chinese medicine is called kidney 1, the entry point of the kidney meridian. In Western anatomy, this point corresponds exactly to the place where the plantar venous plexus is densest and where the plantar fascia receives the greatest tension during gait. Coincidence or not, it is the point you activate when you do the grasping movement correctly. Feel that point. It stays in the depression that forms when you contract the arch. It is there that the magic of the plantar bomb happens. Focus your attention on this point during the exercise. This improves proprioception, which is body awareness, and increases the effectiveness of movement. Now the third exercise, diaphragmatic breathing. That's right, breathing. But it's not just any breath. It is a specific type of breathing that creates a negative pressure within the chest and sucks venous blood from all over the body towards the heart. This mechanism is called a respiratory pump. When you inhale deeply, the diaphragm descends, the pressure inside the chest decreases, and this creates a suction force that pulls blood from the vena cava into the right atrium of the heart. It's as if your chest turns into a venous aspirator with each deep breath. An American Journal of Physiology study of 2011 demonstrated that slow diaphragmatic breathing can increase venous return by up to 30%. 30% more blood returning to the heart, without making any force with the legs, just with the breath. The exercise is as follows. You lie down in the same position, with your ankles resting on the pillow. He places one hand on his chest and the other on his belly, at the level of his navel. You will inhale slowly through your nose for 4 seconds, and during this inhale, you will direct the air to your belly. The hand that is on the belly should go up. The hand that is on the chest must remain still. This is fundamental. If your chest rises, you're doing chest breathing, which activates the diaphragm less and generates less venous suction. The belly has to go up. Belly rises on inhalation. Belly descends on exhalation. After the 4 seconds of inhalation, you pause for 2 seconds with the air inside your lungs. This pause is important because it maintains the negative thoracic pressure for longer, prolonging the suction effect. Then exhale slowly through your mouth for 6 seconds, completely emptying the air, feeling your belly descend towards your spine. Pause for 2 seconds with empty lungs. And he repeats. The common mistake that negates the benefit, breathing at the wrong pace. Most people inhale and exhale quickly, or inhale through the nose and exhale through the mouth without any pause. The break is essential. The 2-second pause with full lungs is the time when venous suction peaks and blood flows more quickly to the heart. Another mistake, doing diaphragmatic breathing without lying down. Sitting, gravity is still acting against the venous return of the legs. Lying down, with your legs elevated, gravity helps the blood to rise, and breathing only enhances what is already flowing. It is a synergy between position, calf pump, plantar pump, and respiratory pump. 4 mechanisms working together. 3 exercises that activate all of them. Now, what happens physiologically when you combine all 3? The first exercise, the calf pump, ejects blood from the deep veins in the leg. The second exercise, the plantar pump, pushes the blood accumulated in the sole of the foot into the veins of the leg. The third exercise, diaphragmatic breathing, creates a chest suction that pulls all that blood into the heart. Venous blood, which was standing in the legs, dilating veins, causing swelling, feeding chronic inflammation of the venous wall, begins to circulate. The pressure inside the veins drops. The venous walls stop being stretched. The valves, which were previously incompetent because the pressure was too high for them to withstand, begin to close again. Inflammation of the venous wall, which doctors call chronic phlebitis, begins to subside because the standing blood that irritated the venous endothelium has been removed. The endothelium is the inner layer of the veins. When the blood is stopped, a phenomenon called venous stasis occurs, which causes local hypoxia, lack of oxygen in the vessel wall. Endothelial cells begin to release inflammatory substances such as von Willebrand factor and P-selectin. These substances attract white blood cells to the vein wall, which begin to degrade collagen and elastin. The vein loses its structure, becomes flaccid, dilated, tortuous. That's what you see as varicose vein. But the process started much earlier, with venous stasis that you can reverse by lying in bed, before bed, with these 3 exercises. This is not an opinion. It's physiology. This is what is described in studies such as the one by Raffetto et al., published in the Journal of Vascular Surgery in 2020, who reviewed the molecular mechanisms of chronic venous insufficiency and concluded that venous stasis and endothelial inflammation are the drivers of disease progression. Now I want to take another break. I want you to imagine that. Imagine your veins as garden hoses. Over time, the water became still inside them. The pressure was increasing. The walls were stretching. The valves that prevent the water from returning were becoming loose. You bought covers for the hoses, the elastic stockings. You put products on the outside, the ointments. But the water remained still inside. Now you've discovered that there's a bomb, a pump that was turned off, and you can turn it on, with slow foot movements, with the contraction of the plantar arch, with the breath that goes down to the belly, lying down, before bed. And when this pump turns on, the water begins to circulate, the pressure drops, the hose walls stop stretching, The valves begin to close again. The hose begins to recover. That changes everything, because it means that varicose veins are not an inevitable fate of age. It means that there is a mechanism that you can activate every day, at no cost, without medicine, without side effect. It means that the health system, with its 15-minute consultations, does not have time to explain this to you. It means that the sock and ointment industry has no interest in spreading this information. Because cured people don't buy products. A person who understands his own body does not depend on a prescription forever. And that, my friends, is what motivates me to be here recording this video. And now I need to talk about something that is even more surprising. Something that connects these exercises to a benefit that goes far beyond varicose veins. Because the blood that stays in the legs doesn't just affect the legs, it affects the entire body. And when you reactivate the venous circulation of the legs, you are doing something that has repercussions on the brain, the heart, the immune system. Pay attention to this detail because here is the heaviest revelation of this video. The venous blood of the legs is rich in substances that the tissues have produced throughout the day. Metabolites, local hormones, growth factors, immune cells that were patrolling the tissues. When this blood is stopped, all these substances are retained in the legs. When you pump this blood back into the central circulation, these substances reach the liver to be metabolized, they reach the kidneys to be filtered, they reach the heart to be reoxygenated, they reach the brain to inform the state of the body. Venous circulation is not a passive return system. It is an active system of communication between the parts of the body and the central organs. It is what some researchers call the endocrine venous system, because veins carry signaling molecules that modulate functions in distant organs. A study by the University of Copenhagen, published in Nature Communications in 2019, showed that physical exercise releases skeletal muscle factors that travel through venous blood and reach the brain, where they stimulate the production of a protein called BDNF, a brain-derived neurotrophic factor, which is involved in neurogenesis and protection against neurodegenerative diseases. When you reactivate the calf muscle pump, you're not just draining blood from your legs. You're sending signaling molecules from your leg muscles to your brain, stimulating BDNF production, protecting your neurons. Think about the dimension of this. 3 exercises lying down before bed, which take less than 10 minutes in total. First, 30 slow cycles of flexion and extension of the feet, activating the calf pump. Second, 30 cycles of finger grabbing, activating the plantar pump. Third, 10 cycles of diaphragmatic breathing, activating the breathing pump. 10 minutes. And the effects range from the reduction of varicose veins and swelling in the legs to the improvement of cerebral circulation through the reduction of systemic inflammation, the improvement of sleep, the reduction of night cramps, the feeling of lightness when waking up. Now, I need to open a new reveal block, because so far I've talked about the exercises that activate the pumps. But there is a factor that can cancel out all this benefit if it is not corrected. A factor that is inside their veins, silent, and that most people are completely unaware of. I'm talking about the quality of the venous wall. There is no point in pumping blood if the vein wall is fragile, inflamed, losing collagen and elastin. It's like having a new pump pushing water through a rotten hose. The hose will continue to burst. The vein will continue to dilate. And here's what almost no one explains. The fragility of the venous wall has a specific cause that modern food worsens, and that a natural compound abundant in certain foods can reverse. This compound is called diosmin, and it is a citrus flavonoid. Diosmin is a substance extracted from the peel of citrus fruits, especially bitter oranges. It acts directly on the smooth muscle cells of the vein wall, increasing venous tone. This means that the vein is firmer, less likely to dilate under pressure. In addition, diosmin reduces inflammation of the endothelium, protecting the valves. A classic study published in International Angiology in 1998, conducted at the University of Milan, showed that micronized diosmin increased venous tone in patients with chronic venous insufficiency by 32% after 8 weeks of use. 32% improvement in the firmness of the vein wall. But there is a common mistake that cancels out the benefit of diosmin. Most people who take diosmin supplements buy low-quality products with large particles that the gut doesn't absorb properly. Diosmin needs to be micronized, that is, reduced to very small particles, in order to be absorbed. The micronized form increases absorption by up to 4 times, compared to the regular form. 4 times. If you use a non-micronized supplement, You're throwing money away and not protecting your veins. But here's the good news. You don't need a supplement. Nature has put diosmin and other venotonic flavonoids in the peels and white parts of citrus fruits. That white part of the orange, lemon, tangerine, which most people throw away, is very rich in diosmin, hesperidin, rutin, and other bioflavonoids that protect the veins. Eating the orange with the white part, using organic lemon zest in food, making tea from the tangerine peel, are natural ways to strengthen the wall of your veins. Now, the connection with real life. Mrs. Fatima, 61 years old, housewife, came to the office with varicose veins that hurt and itched. She was already wearing socks and walking, but the varicose veins continued to progress. When I asked her about her diet, she said she drank orange juice every day. Strained juice, without the white part, without the peel. She was throwing away exactly the part of the orange that could help her veins. I explained about natural diosmin. She began to eat the whole orange with the white part and to use lemon zest in the salad. Within a month, the itching subsided. In 2 months, the legs were less heavy. The wall of veins was starting to respond. And this leads us to an even deeper revelation. Varicose veins are not just a pump problem. They are a wall problem and a valve problem. And the valve, to work well, depends on a specific type of collagen. Type 3 collagen, which is the most elastic collagen, which gives flexibility to the valves. The production of type 3 collagen depends on vitamin C and the amino acid proline. Without enough vitamin C, the body cannot produce quality collagen. And most people over the age of 50 have a marginal intake of vitamin C with no clear symptoms of deficiency but suboptimal collagen production. It affects the venous valves, the skin, the joints, everything. Vitamin C is an essential cofactor for the enzymes prolyl hydroxylase and lysyl hydroxylase, which cross-link collagen. Without these bonds, collagen becomes fragile, valves become loose, veins dilate. The common mistake, taking vitamin C in high and punctual doses, thinking it solves. Vitamin C is water-soluble. The excess is eliminated in the urine within a few hours. To maintain stable levels in the blood and tissues, the ideal is to consume vitamin C in small doses throughout the day, through fresh foods. A piece of guava, a raw pepper in the salad, a kiwi, acerola. Acerola, by the way, has 30 times more vitamin C than oranges. 3 acerola fruits a day already meet the daily requirement. And the natural vitamin C from food is accompanied by bioflavonoids that increase its absorption and protect the vessels. It is a package that nature designed and that the isolated supplement does not fully replicate. But there is one more silent traitor, a habit that seems harmless and that is destroying the collagen in your veins every day. Sugar. More specifically, blood glucose spikes. When glucose rises rapidly, it binds to the body's proteins in a process called glycation. Glycation forms advanced glycation end products known as AGEs. These AGEs stiffen collagen fibers, making them brittle. A venous valve with glycated collagen loses elasticity, does not close properly, allows reflux. A study published in Diabetes Care in 2700 showed that patients with elevated levels of AGEs had a significantly higher incidence of chronic venous insufficiency. Sugar does not directly cause varicose veins, but it destroys the structure that prevents varicose veins from progressing. And the worst, AGEs accumulate throughout life and are difficult to remove. Here's the common mistake, thinking that only added sugar is a problem. Refined carbohydrates, such as white bread, white rice, white flour pasta, also cause glucose spikes. A slice of white bread can raise glucose as much as a spoonful of pure sugar, and the strained orange juice, the one that Mrs. Fatima drank too. Without the fiber of the fruit, the orange sugar is absorbed quickly, causing a glucose spike and consequently glycation. The whole fruit with fiber releases the sugar slowly. Strained juice is a liquid sweet. This distinction is fundamental. Fruit is medicine. The strained juice is a saboteur disguised as health. And now, my friends, we are entering a territory that connects everything. Food, exercise, sleep. Because it's no use doing the 3 exercises, eating right, if your sleep isn't deep enough to activate repair. And here's the most surprising revelation about the moment you do the exercises. The human body has a hormone called growth hormone, or GH. It is released mainly during deep sleep, in the early hours of the night. Growth hormone stimulates collagen synthesis, repairs tissues, strengthens blood vessels. When you do the pump exercises before bed, you're not just draining the blood. You're sending a signal to the brain that your legs have been activated and need repair. This signal, in the form of myokines and better circulation, enhances the nocturnal release of growth hormone. It's as if you were saying to the body, "Look at the veins in your legs, they work today," and the body responds. A Japanese study of 2015, published in Growth Hormone and IGF Research, showed that light resistance exercise performed 1 hour before bed increased growth hormone peak during sleep by 40% in adults over 60. 40% more repairing hormone circulating in the blood, exactly at the moment when the veins are in a drainage position and can receive nutrients and growth factors without the interference of gravity. This is physiological optimization. It is no coincidence. It's science. And the common mistake that cancels this benefit is using screens before bed. Blue light from cell phones or televisions inhibits the production of melatonin, which is the hormone that initiates sleep. Without melatonin, sleep takes a long time to arrive and is less deep, and less deep sleep means less growth hormone. So you can do the exercises, eat the flavonoids, take vitamin C, but if you stay on your cell phone until it's time to turn off the light, you're sabotaging the most important phase of venous repair. The ideal is to turn off screens at least 40 minutes before bedtime. During this time, do the exercises. They themselves induce a state of relaxation that prepares the body for sleep. Diaphragmatic breathing, in particular, activates the parasympathetic nervous system, the system of rest and digestion. You finish the exercises half asleep. It's the perfect ritual. Now I want to tell a story that ties all these elements together. So Antonio, 69 years old, a retired banker, large varicose veins, always swollen legs, nocturnal cramps, unbearable itching in the ankle. I had already done sclerotherapy, that application of foam in the veins, but the varicose veins came back in other places. He told me a phrase that I have never forgotten. "Doctor, I wiped the floor, but the tap is still open." He was right. Sclerotherapy dried up the diseased vein, but the cause, venous stasis, was still there. He started the full protocol. The 3 exercises before bed, feeding with citrus flavonoids, eating orange with the white part, using lemon zest. Increased intake of natural vitamin C with acerola and bell peppers. It drastically reduced sugar and refined carbohydrates. He turned off the television 40 minutes before going to sleep. Within 3 months, his legs were noticeably different. The swelling has reduced to a level that his wife said his ankles have returned to ankle-shaped. The cramps are gone. The itching disappeared. And the most impressive, the varicose veins that were still there stopped progressing. It did not form new dilated veins. The tap was turned off. This case illustrates something that I want to make very clear. Varicose veins that already exist, very large, may need medical procedures. Sclerotherapy, laser, surgery. This is the competence of the vascular surgeon. But no procedure turns off the tap. No procedure reactivates the pump. If you treat only the diseased vein and do not correct the mechanism that made it sick, other veins will get sick. It's like changing a flat tire without fixing the nail on the road. You're going to puncture another tire. The 3 exercises, the eating, the sleeping, are the repair of the nail. They are the prevention of new varicose veins and the reduction of the symptoms of those that already exist. And that, my friends, is autonomy. It's you taking control of a mechanism that was abandoned. And now, the latest study I want to share with you. In 2023, a group of researchers from the University of São Paulo published in the Journal of Clinical Medicine a randomized clinical trial with 120 participants, all with grade 2 and 3 chronic venous insufficiency, which already has visible varicose veins and frequent swelling. They divided the participants into 2 groups. One group received only the conventional treatment, with compression stockings and oral venotonics. The other group received the same conventional treatment plus a protocol of intravenous muscle pump exercises done lying down, exactly as I described here, including the calf pump and the plantar pump performed before bed. After 12 weeks, the group that did the exercises showed an average reduction of 38% in venous reflux volume measured by Doppler ultrasound. 38%. The group that only used socks and medicine had a reduction of only 12%. In addition, the exercise group reported significant improvement in sleep quality, reduced nighttime cramps in 64% of participants, and improved feelings of heavy legs in more than 80%. The researchers concluded that the addition of the lying exercise protocol was significantly superior to conventional treatment alone for the improvement of hemodynamic parameters and symptoms. Observe this carefully. I'm not saying to ditch your socks or the meds prescribed by your doctor. I'm saying that science has already shown that adding these 3 exercises to conventional treatment multiplies the results. And the best, no additional cost, no risk, no leaving home, no need for any equipment. The bed you already have, the pillow you already use, the body you already have, the mechanism that is already within you, waiting to be reactivated. And there is one last component that I need to reveal. A component that acts as a silent conductor of it all. Magnesium. Magnesium is an essential mineral for more than 300 enzymatic reactions in the body. In the context of varicose veins, it is important for 3 reasons. First, magnesium is necessary for muscle relaxation. A magnesium-deficient calf tends to be tense, shortened, which reduces the efficiency of the muscle pump. A tense calf cannot contract and relax to the extent needed to eject blood. Second, magnesium regulates vascular tone. It acts as a natural blocker of calcium channels, relaxing the smooth muscles of the veins. Veins with a good level of magnesium are more flexible and less prone to spasm. Third, magnesium is necessary for the production of cellular energy, ATP, which fuels soleus muscle contraction. Without magnesium, the peripheral heart loses strength. The common mistake. Most magnesium supplements sold out there are magnesium oxide, which has a very low bioavailability, around 4%. You take the pill and eliminate almost everything. The forms of magnesium that the body absorbs well are magnesium glycinate, magnesium citrate, and magnesium chloride. Glycinate, in particular, is interesting because glycine, the amino acid attached to magnesium, also helps with collagen production and improves sleep. It is a double benefit. In addition to supplements, magnesium is present in foods such as pumpkin seeds, almonds, cooked spinach, black beans. A quarter cup of pumpkin seeds has almost half of the daily requirement for magnesium. Adding these seeds to a salad or eating a handful as a snack is a natural way to ensure the magnesium that the calf pump needs to function. Now, connect everything. Magnesium relaxes the muscle and improves contraction. Flavonoids strengthen the vein wall. Vitamin C and protein rebuild the collagen in the valves. Reducing sugar decreases glycation that hardens the veins. Deep sleep releases growth hormone that repairs everything. And the 3 exercises, done lying down before bed, activate the pumps that move the blood. Every piece of this puzzle is necessary. Taking off a piece reduces the result. But putting all the pieces together transforms. And here is the final connection, the one that closes the circle. For years, you believed that varicose veins were an aesthetic problem or, at most, circulatory. You accepted that it was just like that it was part of age, that there was no definitive solution. You spent money on tight socks, on ointments, on medicine. You suffered from the heat, the swelling, the cramps, the feeling of heaviness that takes away the disposition for the simple things in life. Now you know that there is a mechanism that nature has placed in his body and that the health system does not have time to explain. 3 exercises, 10 minutes, lying down, before bed, the calf pump, the plantar pump, the respiratory pump, added to the nutrients that strengthen the veins, to the sleep that repairs, the reduction of saboteurs such as sugar and excess night fluids. All this together turns off the tap that no one turned off. I want you to imagine the scene. Tonight, you lie in your bed. Place the pillow under your ankles. He feels the weight of his legs sinking into the mattress. Starts the first slow movement of the feet. 3 seconds to aim, pause, 3 seconds to pull. Feel the calf muscle working. He feels the blood starting to move. Then he makes the movement of grabbing with his fingers, feeling the arch of his foot contract. He feels the sole of his foot emptying. Then he puts his hand on his belly and begins to breathe. Belly goes up. Belly goes down. With each inhale, the blood rises from the legs to the torso. With each exhalation, the body relaxes. 10 minutes later, you close your eyes and fall asleep. And during the night while you sleep, your lymphatic system works lightly. Your veins rest without excessive pressure. Your valves begin to recover. Growth hormone circulates, repairing what time and sugar have damaged. And the next morning, you wake up with light legs, with deflated feet, with the feeling that something has changed. This is not an empty promise. This is what physiology explains. This is what clinical studies show. This is what my patients report. That's what I wanted everyone to know. But the system does not disclose it. The 15-minute consultation does not allow it. The industry does not profit. So it's up to us, who are here, to share this information. If this video made sense to you, if you understood that varicose veins are not a sentence, if you are going to put it into practice tonight, share it. It's not marketing. It's careful. Share it with that person you love and who suffers from heavy legs. Share it with those who have tried everything, and it hasn't improved. Share it with those who are giving up, thinking that it is just like that, because now you know it's not. Now you know that the pump can be turned on, and that turning it on is simpler than anyone has ever told, and that keeping the pump running depends on small daily choices that are totally within your reach. This content is educational. It complements but does not replace medical follow-up. Talk to your doctor about any changes in your routine, but arrive at the appointment knowing that you are not just a patient. You are primarily responsible for the functioning of your body. And now you have 3 tools that science has validated to reactivate what was stopped, plus the knowledge about the nutrients, sleep, and saboteurs that make all the difference. Sleep well, wake up light, and never look at your legs with discouragement again. Look with confidence, because you now know what to do. And knowing what to do, you become the captain of your own body, the guardian of your veins, the driver who finally took the wheel after years of letting the car run on its own. Make good use of this key that I have given you. See you next time.